If you suffer from drop foot, this is a video for you. My name's Daniel Lawrence, you're watching the Physio channel. And in this video, I'm going to show you how a simple device can stop drop foot, stop you catching your toes, and get you back to walking. So drop foot or foot drop is when your foot fails to lift when you walk. It makes walking more difficult and more hazardous, as lifting the foot and toes up is an important part of our walking pattern. We call this walking pattern the gait cycle, and this foot up motion is called dorsiflexion. Foot drop occurs when the common fibular nerve innervating the tibialis anterior muscle is damaged. This can occur at any point from the spine to the muscle compartment in the front of the leg. Conditions of the nervous system, such as MS or PVD, can also cause this condition. If you don't know what's causing your drop foot, make sure you get a medical assessment straight away. So this device will quickly restore your walking pattern by helping to hold your foot up when you walk to prevent you from catching your toes. Stay tuned because I'm going to show you how to fit one of these in just a moment. When my patients present with drop foot, I look to see if they can lift their foot up towards the knee when there's no weight going through their leg. So if they're unable to lift their foot when there's no weight through the leg, then I'll feel across the front outside of the shin to see if there's any flickers of muscle activation. Whenever possible, I'll get my patients to do some tibialis anterior strengthening exercises, such as the one shown here, using a simple resistance strap tied around something sturdy and pulling my toes towards my knee to activate that tibialis anterior muscle. Sometimes I'll use a massage tool to try and stimulate the nerves, and sometimes I'll use vibration to try and stimulate the muscles as well. Here's how to fit an ankle-foot orthosis. The one I'm using here is from a brand called Ossa. These are the ones I've used in my clinic, but there are other brands available, and in the description for this video, I'll put some links to some other alternatives. But I would certainly recommend this one because I've used this with great success with some of my previous patients. This device is designed for a laced shoe, so I'm going to go ahead and detach the shoe piece and show you how to fit that onto the shoe. With a laced shoe, such as one of my trainers here, you need to make sure that the tongue of the trainer is free from the laces. Sometimes the laces go through a little loop on the tongue of the trainer. You just need to make sure the laces are free so that the tongue can move around. Then take this, place that between the laces and the tongue, bring the elastic out from the mid laces. If it's too low, it will be too tight and the elastic may not stretch to reach the leg. And if it's too high, there may not be enough tension in the elastic to pull the foot into dorsiflexion. So don't be afraid to experiment and reposition this piece. With the shoe on and the elastic strap sticking out of the top, you then need to put on the ankle strap. Place that just above the ankle, pull the straps around tight and fasten the Velcro. Making sure that the clip is in line with the elastic cord. If you're having difficulty connecting the clips, simply bring your knee over your toes. That'll bring the clips closer together. The elastic cord will then hold your foot up and prevent foot drop. And now you can see that the ankle-foot orthosis keeps the toes up, so as the foot comes through, the toes aren't catching on the ground. You can see the elasticity naturally pulls the foot back up into a dorsiflexed position. This allows you to walk easier, faster, and with less risk of trips and falls. Next, watch this video on strengthening exercises for walking, or this video on strengthening exercises specifically for that tibialis anterior muscle. And if you do go and purchase an ankle-foot orthosis, let us know in the comments how you got on and leave some other recommendations for our viewers. Thanks for watching. See you in the next video.